Perfect. Okay, so my name is Sarah Stoddard. I am the director of the Education and Training Core for the Injury Prevention Center. I'm also a faculty here at the university in schools of nursing and public health. And then Taylor's also joined me or us today, and she is kind of one of our project managers, program managers, and she really does a lot of the kind of work around the training and education core activities. So if you have questions later, Taylor is probably the best person to reach out to. You can also reach out to me, and we will provide that information at the end as well. So I am going to talk about our summer internship program and hopefully provide some information and answer questions. Let's get going. So I'm going to give just a little bit of overview about the Injury Prevention Center, and then a little bit about injury, and then we'll go into more details about the internship opportunities. So the University of Michigan Injury Prevention Center is one of 9 academic research centers funded by the CDC. We started our funding and were first funded in 2012 and have been funded since that time. And all of the injury control research centers have kind of 3 areas of focus, or 3 cores, and that's research, outreach, and training. And so what you're going to hear today mostly is about one of our training activities. You can also see that our the injury control research centers are really scattered, mostly on the kind of East Coast, few mid kind of US, and then one on the West Coast. So the injury prevention focus areas vary from center to center. These are the areas that our center tends to focus on: opioids and overdose, suicide, youth violence, concussion, motor vehicle crash, older adult falls, ACEs and other emerging areas, and then global injury prevention. So our actually topic areas are pretty broad. Some of the centers are more narrowly focused, but we have we benefit from a lot of researchers and kind of faculty that have interest in a broad range of injury topics. So when we talk about injury, what do we mean? It's really any unintentional or intentional damage to the body. And that can be due to many different kind of mechanisms for that injury. And we're really using, this is CDC's definition of injury. So why is injury prevention important? We know that everyone can really be affected by injuries, and that injuries are the most common cause of morbidity, for a great kind of span of the lifespan. So from age 1 to 44, that is the most common cause of death is injuries. And, while that's a common cause of mortality, we also know a lot of people are injured every day and really can have lifelong consequences related to their injuries. And so, there's a large financial cost sometimes for people who experience injury. And kind of due to loss of work or disability and those things. And we know that injury is preventable. And so that's why it is an important topic as well. So here's a graphic that shows unintentional injury as number 1, like I just mentioned, really across the lifespan. So this really highlights other forms of injury. So unintentional injury is number 1. And then you can see for adolescence and into early adulthood, suicide and homicide are also common and kind of highly ranked causes of death. So you may wonder why, learning about injury might be interesting too, or important. There are many opportunities for careers in injury prevention, and they really can range kind of for type of like organization to kind of different kind of experiences. So there are careers in government related to injury. We often partner, with our CDC partners or with the state health department on injury-related activities, and they have staff there that head up injury prevention programs, and that also includes county level programs, Detroit Health Department, for example, as well. A number of hospitals and health systems have also kind of begun having centers and employees that do focus also on injury. There are nonprofits and academic centers that do work around injury. Safe Kids Worldwide is one of those nonprofits, National Safety Council. And then there are private sector companies that also focus on injury. So I'll talk a little bit about our internship program. So each summer, we typically hire 5 interns. These are paid internship opportunities. Most of our internships are for graduate students, but we do typically offer at least one for an upper level undergrad student. We look for interns that are interested in injury prevention research or practice experiences, and this could be either unintentional injury or intentional, like related to violence. Our internship opportunities offer really students opportunities to get research experience or practice-based experience in either our CDC funded center or with some of our community partners. And we do set up our internship experiences to meet the practicum internship requirements for the MPH programs. So it's important in your application to write. We'll look to see what program you're in. But if you are in an MPH program, we know that you're looking for some of those competencies and practice opportunities and things. So we try to kind of fulfill some of those kind of content requirements with the experience. So who's eligible? Like I said, a number of our internship opportunities are for grad students. So you have to be enrolled in a graduate program or in medical school at least through December of 2023. So you do need to be returning to school the fall after the summer intern program. For our undergrad opportunity, you must be either a rising junior or senior at the time of the internship. And then we really do, so I didn't mention, but we do have one opportunity as well at the Center for Disease Control and Prevention. So one student is able, and this is often, it used to always be you would go to the CDC in Atlanta. The last couple of years, they've been virtual opportunities or remote opportunities. And we will kind of see over the next couple months whether that will be an in-person or remote opportunity. And those opportunities really are only available for public health grad students. But students from any accredited university are eligible to apply for our more local experiences, but we do give preference to our University of Michigan students, but that includes University of Michigan Flint or Dearborn campus students as well. So here's some examples of placements that we've used in the past for students. So our local internships, they have been right at our Injury Prevention Center working on projects in our center. Sometimes we've partnered with the Prevention Research Center that's based in the School of Public Health. The Concussion Center, we've had students do work with, like I said, Michigan Department of Health and Human Service or the Detroit Health Department. Washtenaw County we've worked with in the past. So there are a number of kind of different local experiences that we look at. And then, like I said, we do offer one CDC internship experience. And hopefully that will be in Atlanta this summer. So interns are expected to work at least 318 hours, and I believe that still meets the MPH requirements for the summer internships. And that is usually somewhere between 27 and 30 hours a week, kind of across a 3-month period. And really, once you are kind of selected and matched with your placement site, we really let you and the preceptor kind of decide what the hours look like and what the timing looks like for that. Another requirement is we ask all our interns to complete our massive online course that's focused on injury prevention. And then we do ask our interns to participate in a seminar series that kind of goes across the summer. So it's a weekly kind of 1 hour lunchtime seminar that we cover. We invite some of the experts that participated in the massive online course to talk about some of the content areas. We invite people working in the field of injury prevention to come and talk about, kind of careers in injury or different experiences in injury prevention. So we kind of try to offer a variety of topics related to injury prevention, or that might be relevant to someone who wants a career in injury prevention. And then we ask our interns to do a final presentation. Usually it's in the kind of early fall after you're done with your internship, really to share your experience, kind of being an intern and your kind of experience in injury prevention. So we do, as I said, they are paid internships. We do offer a stipend of $1,900 a month for 3 months. So it's broken into 3 payments over the summer. And then the CDC placement, if you do go to Atlanta, you do get an extra $500 for to kind of cover some of those travel costs back and forth from Atlanta. But then the rest of the stipend is the same. It's just the $500 additional add-on for travel. So the applications are due on December 16th at 11:59 p.m. And in the application, there are places to note whether you're interested in a local experience or in the CDC placement. If you're interested in both, you can just submit one application and note that you're interested in either experience. And then we really place you with the opportunity. So in your application, you'll want to write about, kind of what you're interested in, maybe what experiences you've had, what you'd like to learn more about. And what we do is we look at our placement opportunities and we try to match you with a placement that might be a good fit, either for kind of your background or your interests, or, maybe what you hope to kind of learn and engage in. And then our hope and our plan, and we were successful in doing this last year, we were able to kind of let applicants know by February 1st if they will, if they're being offered a placement for the summer. We like to try to let students know early because we know they want to plan and kind of know what the plan is for the summer. So like I said, the basic application components, we want to know, information about you, what program you're in, and then your contact information, of course, so we can get back a hold of you. We want a CV or a resume. A CV is just a fancier, more academic looking resume, but your resume is also just fine. 2 letters of recommendation, and then a personal statement. And in that personal statement, like I said, I would encourage you to talk about your experiences, what you're interested related into injury, those kinds of things, because they help us with your placement. And then here are just a couple quotes from students who've participated in the internship in the past. I would say for the most part, I think all of our interns would say they had a good experience. I think some interns really talk about having a great experience and it really being a great match and a great fit. And that's always our goal. But sometimes that's harder to accomplish, to find the perfect fit. But I think most of our students have good opportunities with their placements, with the organizations that they go to, and learn a lot about injury prevention and what a career in injury might look like. Here's a second one. Brianne actually worked with me a little bit too. She's talking about her other experience. She kind of had a split experience. So worked partly on this project and a little bit on my project. So this is information. So if you want more information about other training opportunities, including the summer internship opportunity, you can find that on our website. And then this is Taylor's email address. If you have questions after today that either we don't answer now or weren't part of the presentation. And then, we do offer other learning opportunities. So do check out our website. We do have the injury science certificate offered through the School of Public Health that we collaborate with them on. We often have different seminars or workshops that may be of interest. So you can become a member, which doesn't take a lot. We just want your information a little bit and an email address, and you can be added to kind of our listserv to learn more about other opportunities as well. So I might stop sharing my screen for the moment. We can always go back and look at slides if we need to, but I'm happy to take any questions if you have any. And you can put them all in the chat as well. So there was a question about if decisions are made on a rolling basis. No, we look at all the applications together after the 16th. So we look at that kind of late December, really early January. And then, like I said, we look at our placement opportunities, our student applicants, and try to do matching and then let students know by February 1st. So letters of recommendation, Taylor, how do I think often we ask for at least one letter of recommendation from someone who's like a faculty member that you've connected with in your program. That could be your faculty advisor, that could be someone who's maybe teaching one of your courses. But usually we ask for at least one that is a faculty member. And then the other one can be, maybe from someone who's worked with you before, who maybe knows some of your strengths, how you might be as, someone to work with or collaborate with. Because I know sometimes, especially if this is your first semester, you might not know a lot of faculty or have as in-depth relationship with a faculty member, but we like to have some kind of faculty input, and but that other letter could be from someone who maybe knows you better. Taylor, do we have a word limit on our personal statements? This is what I can't remember. This is why I need Taylor.
Yeah, 500 words or less. And if you take a look at our website, there is the full internship announcement. So there's more of the detailed information there, and that's where you'll find the 500 words or less specifications.
Any other?
Actually, I can put a link in here.
Yeah.
Yeah, hi, Sarah and Taylor. Thank you for the very informative session. I'm Sneha Alexander. I'm a first year international MPH student.
Okay.
And I'm extremely interested in children's health and well-being over the course of my career. And as we're all aware, there's an increase in gun violence in schools and colleges. So I just wanted to understand if there's any pediatric research happening or collaboration with researchers who focus on children's health and well-being that's taking place.
So we definitely have a number of faculty that I would say do work in what I would think about as more the adolescent space, or the little bit older school age and adolescent. But that doesn't mean we do sometimes have either faculty or like organizations and community partners that might be doing some more child-based work. So, I mean, I think if you're interested in that, I would still encourage you to apply and express kind of that interest. And, there may be opportunities that get more into childhood than adolescents. Like I said, we have a lot of people that do adolescent and young adult work, but I wouldn't say, I would say we sometimes also have child opportunities. Would you agree, Taylor, with that? Yeah.
Thank you. I mean, that was the second part of my question as well, whether should I look at focusing on an area in my application, or should I just be broad in my approach? Yeah.
Yeah, I guess that's always, kind of the debate. I think it's sometimes the more information we have about what you're interested in, I think the better the match might be that we can offer. So in the end, you might have a better experience if we know more about what you might be interested in. So I would give some specifics as to what you're interested in. You might want to name, if there's a couple areas, you might want to mention those, but, I think giving as much detail as, you can is just helpful on also getting a good experience.
Sure. Thank
Yeah.
you so much. That's a helpful answer. Thank you.
Yeah. So our undergrad experience is new just the last 2 years. But I do think we are committed to offering an undergrad experience this year again. So I would say I would be pretty positive that we'll have an undergrad experience. I think sometimes we also look for a good placement for an undergrad. So that's kind of what we're also weighing into that. But I feel pretty confident that we will offer an undergrad experience. So I encourage undergrads to apply. Yep. So our interns, we do offer them every year. And we have since, I think they did start even before 2012. I think we had some summer interns, but so we do always offer them. And typically it's around 5. And, the timing, for a student, that's probably the more important part to look at. Just to make sure that you would be returning to school the following year. So if you were in a 2-year MPH program, your opportunity is really that time between your first and second year. Now, I know we've had a number of students who've done like dual degrees in an MPH and an MSW. And so sometimes there's a little more flexibility because they typically are, crossing into 2.5 to 3 years. So they really have kind of 2 opportunities maybe to apply. So hopefully that answered that question. But yes, every year we do offer it. Any other questions? Well, we can also wrap up. And again, I can hang out for a second more if anyone wants to, if they have anything else, but keep in mind, the deadline. Go to our website if you want more information about this opportunity or other opportunities, and, reach out to Taylor if you have any questions, as you're either working on your application or that maybe weren't answered that are specific to you. I would say one thing we do have, someone mentioned being an international student. There is more challenge sometimes with sending international students to the CDC. So that would be the only thing I would say about that. And that's some of the security and things that happen in the CDC. If you're interested in that, I would reach out to us more specifically, and we can talk more about that. But it's not really an issue more for our more local experiences. So Great. Great. Thank you, everyone.